swine flu began spreading through Mexico in the spring of 2009, I didn't really understand the impact. It wasn't until it crossed the border into the United States that I grasped the reality of the oncoming swine flu pandemic. When a few of my friends fell ill, I understood the impact of this new strand of the virus. As the pandemic developed, I became aware of how our government, federal, state, and local, had to get involved to protect the citizens of America and work to prevent the pandemic from getting out of hand. This new strand of influenza created a media frenzy. When it came to the swine flu outbreak, the media played a key role in developing this story. It was through this media frenzy that I began to see the role that our government played to make sure we got accurate information on the progress of the disease.
We're one country, we're one community. When one person gets sick, that has the potential of making us all sick. And that means that government at every level has to make sure that good information is getting out to every part of the broader American community.
The government was mobilized in 2009 to prevent the nationwide spread of the H1N1 influenza. The federal, state, and local governments took preventative action to avoid the creation of another national disaster. The federal government has the responsibility to protect the common good. As the leader of the country in this time of crisis, President Barack Obama coordinated federal agencies and the private sector to identify the flu strand, develop a vaccine, and make it available nationwide. The Department of Health and Human Services and the CDC concentrate on providing essential human services and protecting the health of American citizens. The CDC's mission is to provide the information and tools that people and communities need to protect their health. In the summer of 2009, the scientists at the CDC worked to collect data from national agencies and track the swine flu. Based on the information they collected, the CDC worked with the private sector to create a safe vaccine.
We'll also cover vaccine supply, which is expanding with increasing access in many parts of the country, and highlight that it is still a good window of opportunity to get vaccinated against H1N1 influenza.
With the CDC working to supply vaccines, Congress was working with President Obama to provide the funds necessary to deliver the vaccines to the people. South Carolina Congressman Jim Clyburn sees a link between the stimulus money and the availability of the vaccine.
We were putting together sort of a recovery package or stimulus plan or whatever one might want to call it. So it allowed us to do some things pretty much off budget. We got to spend some money, we got to get this vaccine developed, and we got to get it distributed.
The federal government provided the essential funding necessary to protect the American citizens from the swine flu. Despite the government's efforts, the swine flu still became widespread, with official reports of above 44,000, and with other reliable sources putting the unofficial total of U.S. cases at over 100,000, with 10,000 deaths. These numbers provided the motivation to distribute vaccines nationally as the states began to play their role in preventing the spread of H1N1. Dr. Jerry Gibson from the South Carolina Department of Health and Environmental Control explains the relationship between a spring break trip and the entry of swine flu into the state.
In Carolina, we saw it first in Newberry High School students. Remember, they'd been on their spring trip to Cancun, and they came back bringing the novel H1N1 virus with them.
Despite the onset of the virus in the state, South Carolina slowed the spread thanks to the stimulus money received from the federal government.
South Carolina did get millions in federal funds to address this issue.
This let the state provide free vaccines to many people, especially students and the elderly.
We have to buy influenza vaccine that the state health department distributes, and the private doctors have to buy it from the health manufacturers. But for a 2009 campaign, the federal government produced and owned the vaccine, delivered it free, so we had no dollar limitations on immunizing people.
With the money now in the hands of the state government, the picture changed to a local level. School vaccination became a reality, according to Kathleen Sebelius, Secretary of the Department of Health and Human Services.
Schools and actually daycare centers and others are very appropriate outreach sites to reach the population who we need to reach. And so working closely with the Secretary of Education and his counterparts, superintendents and governors, and I think most governors are very enthusiastic of having the schools be voluntary vaccination sites.
We were one of about 10 states that did widespread, maybe a dozen, that did widespread school clinics. And it got coverage of people in the primary school and the teen age groups up much higher than in most parts of the U.S. And in fact, South Carolina was in the highest stratum of flu immunization coverage for school-age kids.
One South Carolina school district that went above and beyond to provide for its students was Richland School District 2. It set up free clinics in its elementary, middle, and high schools. With parent permission, students were vaccinated. Our school nurse sees the link between school clinics and prevention.
We got involved with the health department on planning to vaccinate students in Richland School District 2. So all told, we vaccinated about 14,000 people. So that's roughly, we had at least 30%, 30 to 40% probably participation.
There were deaths and large numbers of people infected. However, because action was taken by all levels of government, the swine flu outbreak of 2009 was managed so that it did not develop into a national disaster. I learned that in a time of crisis, the government must work collectively to protect the common good. In this time of crisis, the federal government provided the necessary funding and the vaccines. The state government organized the distribution of the vaccines, and the local government served as the grassroots for implementing the vaccines. We will never know how serious it could have been if all levels of government had not worked together.